Regarding the ASIA staging, it is a grading of motor and sensory disturbances, which is done when a spinal trauma patient comes up. It is basically a chart which gives a score. The basic principle of ASIA starts come from Frankel et al., which is classified into 5 different grades. First is in which there is absent motor or sensory system uh, sensations. So there are no motor, no sensory sensations. Grade 2 is the one which has some sensory sensations. Grade 3 is unuseful motor sensations. That is, 50% of the muscles are less than 3. Then grade 4 is the one which has some sort of motor activity is possible, and grade 5 is when you have complete motor activity.